Good morning. I'm very pleased to be invited to speak to you about isoflavones and breast and endometrial cancer. Here are my disclosures. So I'm going to talk about soy and breast cancer first, looking at two aspects of the topic. First of all, prevention of breast cancer, and we'll also look at the Asian and Western population differences and the importance of early intake of soy. And secondly, look at soy, isoflavones and breast cancer patients in terms of recurrence and prognosis. So first of all, soy isoflavone intake and breast cancer risk. There have been a large number of epidemiological studies, and meta-analyses of these studies indicate a modest reduction of 10 to 30% in risk with soy isoflavone intake. Here are just four of those studies. You can see they range between around a 30% reduction to down to 10% reduction in some studies, depending on the number of epidemiological studies they include in the analysis. But this hides differences in response of Asian and Western populations. So if you look at the Asian populations, the reductions in risk are around sort of 30 to 40%, whereas there is no significant effect of isoflavones on breast cancer risk in Western populations. So why do they have so little effect in Western populations? There's two possible reasons, at least. First of all, the low intake of soy isoflavones in the Western studies by comparison to intake in Southeast Asia. So in the US and in Europe, we're lucky to get over 1 milligram per day, whereas in Japan and China, it can be 20, 50, sometimes over that, 50 milligrams per day of isoflavone life can lead up to about a 40% reduction in risk. And this is seen also in a Chinese women's health study, which is a prospective study. Again, high intake in adulthood or adolescence is associated with a reduction in risk here, but a high intake throughout life in adolescence and adulthood can result in about a 60% reduction in risk. Now, the second aspect I want to talk about is, are soy isoflavones safe for breast cancer patients? There are a number of concerns in this area, partly because isoflavones have similarities to estrogen in terms of their structure. Many breast tumors are estrogen dependent, and hormone replacement therapy, we know, increases the risk of breast cancer. And also there are a number of rodent models which show increases in tumor growth with isoflavones. But what do the human trials tell us? This is the important data. These are the important data. So does post-diagnosis intake of soy isoflavones affect tumor recurrence or survival of breast cancer patients? There have been a number of cohort studies in this area, and a meta-analysis of 5 of those cohort studies, 2 in the USA and 3 in China, involved 11,000 patients, nearly 1,000 deaths, and around 1,400 recurrences. And if we look at the hazard ratios overall, there was no increase in mortality or recurrence. In fact, a modest decrease in mortality of around 15% and a decrease in recurrence of around 25%. And this was seen across estrogen receptor status and menopausal status. It wasn't always significant in terms of recurrence, but there was a significant decrease in mortality irrespective of estrogen receptor status and whether premenopausal or postmenopausal status. There's also been concern that soy isoflavones might interfere with drugs used for treating breast cancer, typically tamoxifen and anastrozole. But again, the studies, the epidemiological studies indicate there's no effect on efficacy of tamoxifen. Here we see recurrence and mortality. Tamoxifen users do not show increase in recurrence or mortality when soy is consumed. Similarly with anastrozole, as you increase the intake of isoflavones, in fact, the hazard ratio decreases significantly. So there's no interaction between soy and the major drugs used for treating breast cancer. Now, those are epidemiological studies. What about clinical trials? One of the main markers of breast cancer risk in postmenopausal women is mammographic density. And Hooper et al. Have done a meta-analysis of 8 randomized controlled trials of isoflavones in healthy pre and postmenopausal women, and they found no significant effect on breast density of isoflavones overall or in postmenopausal women. There was a small increase in premenopausal women. Wu et al. Conducted a 12-month clinical trial with isoflavones in breast cancer patients or in women with high risk of breast cancer, and they found, again, no effect on breast tissue density using MRI. And finally, Ferraris had a 2-year randomized controlled trial, not with soy isoflavones, with red clover isoflavones in premenopausal women with breast cancer. And again, no effect versus placebo on breast density. Another marker of breast cancer risk is breast cell proliferation, in vivo breast cell proliferation. 6 studies on soy isoflavones covering quite a wide range of intake, 36 to 235 milligrams per day, in healthy women, in breast cancer patients, and in people and women with high risk of breast cancer, showed no significant increases in breast cell proliferation. So the conclusions we can draw from these studies are that meta-analyses indicate that soy consumption is associated with a modest reduction, maybe 10 to 30% in breast cancer risk, but the effects are much greater in Asians than in Western populations. There's also some evidence that consumption of soy during adolescence may result in a much greater decrease in risk. And finally, soy isoflavones are safe for breast cancer patients. The epidemiological studies show there are no adverse effects on recurrence or mortality. In fact, some of the studies show a modest reduction in risk of recurrence and mortality. There's no interference of soy isoflavones with tamoxifen or anastrozole therapy for breast cancer. And there are a number of randomized controlled trials which show no effects on breast density or cell proliferation. And these, the safety of soy and soy isoflavones for breast cancer patients have been endorsed by these organizations here. Let's move on to endometrial cancer. It's the 7th most common cancer in women, has a high incidence in the US and in Europe, a lower incidence in Southeast Asia and Africa. And migration studies show that lifestyle and not genetics are important in the etiology. We do know that estrogens are involved in etiology, and we're also that hormone replacement therapy with estrogen alone can increase the risk of hyperplasia and cancer by 2 to 3-fold, in some cases more. So therefore, there's been some concern that isoflavones could increase the risk of endometrial cancer and also stimulate the growth of existing tumors. So again, what do the human studies show us? This is a meta-analysis of case control and prospective studies of soy foods on endometrial cancer conducted in both South